HSC 114, Intro to Pharmacology, Chapter 8, Hematologic Drugs. Chapter 8 covers drugs that are used to treat diseases of the blood, including anticoagulant drugs, thrombolytic drugs, drugs used to treat anemia, and drugs to treat hemophilia. Anticoagulant drugs. Drugs used to prevent blood clots. There are two types of drugs that are used to prevent blood clots, anticoagulants and antiplatelets. Because blood clotting is coagulation, they are sometimes grouped together as anticoagulants, as in this chapter. However, there is a significant difference in the mechanism of action of a true anticoagulant class and an antiplatelet drug. For the purpose of this course, being an introductory level, I will follow the text and address all drugs that inhibit clotting as anticoagulant. The first group are antiplatelet drugs. The first step of coagulation includes platelets clumping at the site of injury to slow down the flow of blood. Antiplatelet drugs prevent platelets from sticking together and starting the clot. Aspirin is available as an over-the-counter drug and is the least expensive of all antiplatelet drugs. Shown here is an 81 milligram dose, known as a low-dose aspirin, that is used to prevent a blood clot from forming in patients who have had heart disease or have had a stroke. Clopidogrel was the first antiplatelet drug approved by the FDA. As with a number of other drugs, this drug should not be taken with grapefruit or grapefruit juice because they decrease the drug's effectiveness. As we see here on the yellow section of the drug label, it tells the pharmacist to dispense with an accompanying medication guide for each patient. This guide, also located at the top of the cap, is very thick because it contains a great deal of information about how the drug works and how to use it safely. Now I'm going to stop here because I'm actually reading the content from the chapter, and as I'm reading that and I know pharmacy, that is all incorrect. What's on top of the package is known as a package insert. This is going to have scientific information. Yes, it's got a ton of information, which is why it's very thick. But when it's saying give it a medication guide is something that's dispensed from the pharmacy that includes information about especially important adverse potential side effects. So that's actually what a medication guide is. Anyways, back to the book. So here we have clopidogrel, which is known by the brand name of Plavix. Injectable form, tirofibin, is agrestat. And then we also have combination drugs that contain an antiplatelet drug, such as aspirin and dipyrimidol, as we see here, known as Agranox, or it could be excuse me, an antiplatelet drug with a proton inhibitor, such as omeprazole, that will help prevent gastric irritation from the aspirin. So Agranox is aspirin and dipyrimidol. Direct thrombin inhibitors are a true form of an anticoagulant. These drugs block the activated form of a coagulation factor. They are most often used to prevent blood clots in patients undergoing procedures such as angioplasty or surgery. Desarudin, Iprivosat, is administered subcutaneous. Bivalirudin, as we see here as Angiomax, is administered IV, and dabigatran Pradaxa can be administered orally. Direct thrombin inhibitors that are administered through injection have the drug stem of rudin. Dabigatran Pradaxa is taken orally. It does not have that rudin drug stem. Factor 10 alpha inhibitors. X is the Roman numeral for 10, so it's a factor 10, which is one of the clotting factors. There's factor 8, 7, 8, 9, 10. The drugs in this class are used to prevent blood clots in patients who have coronary artery disease atrial fibrillation, pulmonary embolism, or a deep venous thrombosis. So here we have Xarelto, which is rivaroxaban, and it's listing those challenges. So it helps reduce the risk of stroke from atrial fibrillation, prevent deep venous thrombosis or DVTs, and pulmonary embolisms, which are blood clots in the lungs. So phenoxyparinix is Ertrixa, which was the first drug in the class, and it's administered subcutaneously, but all of the rest are administered orally. So we've got rivaroxaban, which is Xarelto, which is oral, and then we have apixaban, which is Eliquis, which is also an oral formulation. And the drug stem for the oral formulations is Oxaban. And it's got that 10A, that X for the 10A, it's got OXA, the XA right here in the generic name. Heparins and low molecular weight heparin drugs. Low molecular weight heparin is also often referred to as an LMW. Every single heparin is administered subcutaneously. Heparin alone can be administered IV or subcutaneously, and heparin is measured in units. Now, a low molecular weight heparin, like enoxaparin, which is low Vinox, enoxaparin, low Vinox, the Nox. This is given subcutaneously. Low Vinox is measured in milligrams. Other LMWHs are measured in units. So low Vinox is the exception, being measured in milligrams. Other heparin and other low molecular weight heparins are all measured in units. Now the drug stem that we see is parin. It is important to note that protamine sulfate can be administered intravenously to neutralize the anticoagulant effects of heparin. So if somebody gets too much heparin, we can give them an antagonist in a protamine sulfate. Now a note about heparin and handling heparins. When we're talking about heparin and it's dosed in units, a lot of them look alike. It could be 10 units per milliliter, 100 units per milliliter, 1,000 units per milliliter, 5,000 units per milliliter. It's really important to make sure that the right heparin is selected. If one is too potent, it would cause increased bleeding, and that's why we need to know about that protamine sulfate. The next drug is a vitamin K antagonist drug. These drugs are known as coumarin derivatives, and there's one drug. The drug is warfarin. It blocks vitamin K. Vitamin K is not potassium. Potassium is a mineral that uses the elemental symbol of K. Vitamin K is a fat-soluble vitamin, and it's important for coagulation. In fact, the K stands for a Swedish word for coagulation, so that's where it came into play. By blocking vitamin K, it prevents the production of clotting factors in the liver and is most often administered orally. However, warfarin does come as an injectable. We just don't use it very often. Now, vitamin K is also found in green leafy vegetables, such as spinach and kale, and in soy. So patients who are using warfarin, blocking vitamin K, need to be careful of foods that contain vitamin K, because they're going to counteract each other. So here we have warfarin, generic name. Brand name, we used to use Coumadin as the brand name. Jantoven is now the brand name. But I wanted to show you that it doesn't matter what name, whether it's a generic or a brand name, all of them are going to be color coordinated across every system. So it's important if people switch, which generally they don't, brand names, but they'll know, hey, this is the right color for my dose. It's also a variable dosing. The dosing can get a little messy. They could take one dose Monday, Wednesday, Friday, and a different dose on Tuesday, Thursday, Saturday. there are some complications. Patients who were undergoing anticoagulation therapy with warfarin will have to go and have their clotting times checked. Same with heparin, because we want to make sure that they're clotting properly. Now, patients who are using vitamin K antagonists, if they get too much of the wrong dose, we might use vitamin K to counteract it. Another component to think about, garlic needs to be used with caution because it can increase the anticoagulation effect, which could increase risk of bleeding and bruising. Any anticoagulant, any antiplatelet drug, if the dose is too high, can cause increased bleeding and bruising and can interact with many other drugs that could also have that impact. So phytonadione is the name for vitamin K. We use this to counteract warfarin. We also give it to neonates, newborn babies, in a pediatric preservative-free formulation because they don't have natural vitamin K in their bloodstream yet, and they could actually have excessive bleeding or hemorrhaging. So phytonadione is often given to children. The brand name we would use would be aquamefetin. Mefetin is one of the brand names. Aquamefetin means that it's water-based. And again, we use this as an antidote to reverse the anticoagulation effects of warfarin. So if somebody's not clotting enough, their warfarin dose was too high, we would give them vitamin K. The next group of drugs are thrombolytic drugs. So lyse means to break down. Thrombi is a clot. In this case, it's a blood clot. A thrombocyte is a clotting cell, a platelet. So a thrombolytic is going to break down blood clots. These are known as clot buster drugs. They actually dissolve a blood clot. So heparin, some people think it dissolves clots. It does not. It just prevents new clots from forming or clots getting bigger. This one's actually going to break down the clot. So like I said, they often call them clot busters. So the tissue plasminogen activator or TPA drugs are often used to dissolve a blood clot. We use it in patients who have a heart attack or have had a stroke to return blood flow from a blockage due to a clot. We also use them in pulmonary embolisms to dissolve the blood clot that's already been formed in the artery, whether it's a coronary artery or an artery in the brain or the lungs. Alteplase, it's an enzyme. Enzymes end in ASE. So alteplase is an enzyme. It dissolves a blood clot in this using a central venous catheter. Tissue plasminogen activator drugs are created using recombinant DNA technology. Keep in the refrigerator for the majority of them. They're going to be given intravenously, and they have that drug stem of ASE to identify its enzyme. Again, any and all drugs that inhibit coagulation have an increased risk of bleeding. If somebody's had recent surgery and then they have a heart attack, this drug may not be appropriate for them because that means they could start bleeding from all of their stitches. So it's going to break down all blood clots, not just the ones in the blood vessels. But if we restore blood from somebody having a heart attack, we can limit the damage to the heart muscle, or if we can restore blood flow to the brain, we can limit the damage from a stroke. And if we can dissolve that blood clot in the lungs, then the patient has a higher rate of survival from a pulmonary embolism. Next are drugs used for anemia. Anemia results from a decrease in the number of red blood cells being produced by the red bone marrow. Anemia can be caused by any of the following different conditions, including iron deficient anemia, folic acid anemia, pernicious anemia, sickle cell anemia. So there's many different kinds of anemia. So the drugs we use to treat them will include specific treatment. So erythropoiesis is actually the production of red blood cells. And then specifically to what is the cause of the anemia. Now, anemia that is a result of blood loss or hemorrhage would be treated with a transfusion. We would give medications that would increase the volume in the blood. So the first are, let me say that again, erythropoiesis stimulating drugs. So anemia caused by a reduction in the number of red blood cells due to bone marrow suppression or lack of erythropoietin, which is a hormone that your body produces, actually your kidneys, can be a result of certain types of cancer or complications of drugs, especially chemo drugs or immunosuppressant drugs. So erythropoiesis stimulating drugs, these were once known as colony stimulating factors, but they're specific to production of erythrocytes, which are red blood cells. Erythropoietins have increase the number of red blood cells. They stimulate the body to produce those, specifically the bone marrow to produce them. They are bioengineered drugs, considered to be biologics. They are expensive and they are stored in the refrigerator. Erythropoiesis stimulating drugs are administered subcutaneous or intravenously. So the drug on your list is Epoetin alpha. And Epoetin alpha has several brand names, including Procrit, Epogen, and Retacrit. And we see that they're measured in units, and they are given subcutaneously or intravenously. Now, folic acid deficient anemia is a result of a lack of folic acid. Folic acid is actually vitamin B9 that can affect the growth of new cells, including red blood cells. This type of anemia is treated with vitamin B9 replacement. It's most often also could be referred to as megablastic anemia, because without the appropriate amount of folic acid, you get very large red blood cells that don't function properly. So being abnormally large, that's where megablastic comes from. So the treatment for megablastic anemia or folic acid deficiency anemia is replacement of the folic acid. So folic acid can be purchased over the counter as a nutritional supplement, as we see on the left, but it's also available by the brand name of FA8. Folvate, we actually do it IV in the hospital as well. Now, iron deficient anemia, which is probably the most common type of anemia, in order for a red blood cell to carry oxygen, it has to have properly functioning hemoglobin, and iron is required for hemoglobin. So this type of anemia can only be treated with iron. Iron is identified by the elemental symbol Fe, which stands for ferrous. So we're going to replace their iron. Now, there's a number of different drugs for iron deficient anemia. They're all iron, but there's a lot of different routes. So on this image, there's the over-the-counter supplement. It's a slow release, so it's slow Fe for slow release iron. It can be administered orally here. This is actually ferrous sulfate. We also have prescription, and then we have oral and IV. So iron dextran is in fed, and it's given us that Fe for the iron. And here we see that the container is actually an amber glass bottle. One of the things when you're dealing with medicines and they come in these type of amber bottles instead of a clear glass, think protect from light. It's just one of those kind of visual cues. Now this is iron dextran. So we've got in fed, it's the D for the iron dextran. And then there's also iron sucrose, which is Venofer. And we can think, oh, it's going in the vein, and you've got the Fe in there as well. Now, this isn't a clear container. It's still going to be protect from light. Not everything in a clear container or not everything protect from light is put into an amber. But I like this in a sense because you can see the color of the IV solution. And it's kind of a dark reddish rust color. And iron, when it rusts, when it is oxidized, becomes rust. So this actually makes an IV. Both of these are IVs. They're kind of a reddish color, kind of like a rusty color. So iron sucrose can also be given intravenously. So your book breaks down which ones are oral and which ones are injectables. Just know that it's for iron deficient anemia. Now, pernicious anemia is a fancy word for lack of vitamin B12, which is known as cyanocobalamin. It's one of my favorite words to say. This affects the production of healthy red blood cells. Again, it's deficiency of vitamin B12, so the only way we treat it is replacement with vitamin B12. So the drug we're going to use is cyanocobalamin. Now, this is Nascobal, and it's nasal administration of cobalamin. So they've combined that to give you the brand name. Now, it can also be treated with oral, or we also have vitamin B12 injections. Now, sickle cell anemia is a hereditary disease where the hemoglobin is abnormal and causes a distorted blood cell that looks like a sickle or a half moon shape. So this one on the right is a normal blood cell. It's kind of puffed up. And then over here on the left, we have the sickle cell. It's kind of deflated and makes a half moon look to it. Sickle cell anemia, each agent has a different mechanism. The most commonly used drug is voxelotor, which is known by the brand name Oxbryta. This inhibits the red blood cell sickling and decreases anemia. When it's in this shape, it can't properly carry the oxygen. So it's going to prevent it from doing this, and then the healthier cell can continue to carry that oxygen. One of the other complications with the sickle cell is these blood cells can get kind of caught up in joints and be very painful. So again, you have to be able to identify what is the cause of the anemia to make sure that we're treating it properly. Iron deficient can only be treated with iron. Folic acid deficient can only be treated with folic acid. Pernicious anemia can only be treated with cyanocobalamin. If it's due to bone marrow suppression, not enough bone marrow or red blood cells being produced, we could use one of those erythropoiesis stimulating drugs. And then specific drugs are going to be used in treating sickle cell anemia. Hemophilia is a condition where the blood doesn't clot properly due to a deficiency of a specific clotting factor. There are different kinds of hemophilia, and each one impacts a different type of clotting factor. But before we had anti-hemophilic drugs, the only way to treat congenital hemophilia was with whole blood or plasma platelet transfusions. So if they were born deficient, we had to replace what they were deficient in. And the only way to get that was through blood and blood products. Now, we have drugs to treat hemophilia. These have been around almost 30 years. So these are bioengineered drugs. So again, usually we think expensive and keep in the refrigerator. The drugs used to treat hemophilia will be specific to the type of clotting factor that is deficient. All hemophilia clotting factors are given subcutaneously. Here we have a monoclonal antibody, emicizumab, which is Hemlibra, which in a way, if I look at this, the light bulb goes off. It's kind of like hemophilia, but you're liberated. Like you don't have as much worry. The risk associated with hemophilia is your blood doesn't clot, so even a small wound or a bruise could be very debilitating and even deadly. So Hemlibria is one of the monoclonal antibodies used to treat hemophilia. All right, let's finish up those questions.